Hello, I'm Dr. Ruth Roberts, your pet's ally. I hope you all are well. And thanks for keeping the questions coming. So let's see, let me pop over here to the Facebook page, hopefully. There we go. All right, cool. So, Kathy, thanks for that. We did put in this week's notice, we did put the time in. So it'll be 1 p.m. Eastern every week. So Karen's asking about the keto version of the lamb recipe, and Karen, I have to apologize, that recipe is incorrect. And like many things, that was supposed to have been handled and replaced, but unfortunately it never has been. So with the keto version for the lamb, you will want to use 3.25 pounds per batch. We don't have a regular lamb recipe, but you can use, with beans, 3 pounds of lamb. Now, lamb is fattier, so I would suggest that you drop the oil that you add by 1 tablespoon. So instead of the regular 6 tablespoons per batch, I would drop it down to 5. So I hope that is helpful. And Jamie's asking about heartworm prevention, and I do recommend HeartGuard. And May, I'm not sure what you mean by no response from your vet or from me on the prescription. But anyway, so let me answer Jamie's question. And she's been using Sentinel. The dose is 51 to 100 pounds, and she's down to about 56 pounds. So, Jamie, what I would suggest doing is using, and unfortunately there just isn't a product that has better dosing. So 1/2 tablet will not be quite sufficient, and this is kind of where you want to go ahead and use the appropriate dose. So I think you've got a couple of choices. One is I go ahead and let Willie use up all the Sentinel that you've got left, but do go ahead and switch to a plain HeartGuard tablet or chew. So I think that would be the best. There is some associated issues with Sentinel as far as it causing autoimmune disease with that combination of lufenuron and the milibenzomycin. So I think that would be a good idea. Now, what I was going to say is if you all are having trouble getting your veterinarian to write you a prescription, they cannot do that by law. They do need to write you a prescription for your product. Now, they won't necessarily approve that by fax, and they may make you come pick up a written prescription, but generally all state boards are requiring veterinarians to issue a requested written prescription. So be a little persistent about that. Here's Hio, my mom's dog, is hanging out with us today, so Mom can sleep a little bit better. She is still very confused about all of this. Weird stuff is happening. So let's pop back over to Facebook. And great pictures of Murphy and Mary Bettina. That's wonderful to see them. And our dog Ollie used to do this. He was an upside down on the sofa kind of guy. So thanks for posting those. And then Karen is saying her 12-year-old, her friend's 12-year-old Jack Russell just got diagnosed with vestibular disease, where she was disoriented and had balance issues and was walking in circles, and so sounds like classic stuff. And she's recovered really pretty well, except for a head tilt. And CBD may be helpful because there is some autoimmune kind of component to this. Sometimes it goes, once they've had that episode, it's over with, and sometimes it is, it comes and goes, just like it does for us. So interestingly enough, should that happen again, meclizine is the generic name for an anti-nausea medication that's sold over the counter as Bonine, and it's sold in 25 milligram tablets. And if you cannot get to the veterinarian in time, or you've dealt with this in the past, that's one of the best things to do in the short term. to get one of those episodes over with. And many veterinarians say that, you should just 86 it once the symptoms are better, but I found that many of my patients did well with this over a long period of time, and certainly Esau did. His head tilt would improve with it. So I think although it gets better and they're not staggering, it does seem to help kind of keep things under control. So what I would suggest for a Jack Russell who's probably under 20 pounds is something like try a quarter of a tablet. So that's going to be 12 and a half. That'll be 6.25 milligrams twice daily, and see if that helps with the head tilt. Now that's not necessarily holistic, but CBD may be helpful. And then again, other things that are going to help control inflammation. So this is where turmeric would be a really good option. And then the other thing you could look at would be, I didn't mean to do that. The other thing you could look at would be certainly fish oil probiotics, sort of my standard answers, if you will. But I think this may be, that may be helpful enough. So see if that makes sense, and we'll go from there. But turmeric is available in a multitude of forms. There is Jarrow's brand that we carry that's for smaller dogs, and I think that's been very helpful. And then for larger dogs, especially if we're dealing with a chronic inflammatory condition, that's where the Gaia brand can be really helpful. So there's let's see, and that's at a super high dose. So I'll put the link into the Gaia product just because it's been a little bit more helpful. And let's see here, what else can I do to help you all out? So that's been a good one. And I think that really, let's see, that's all the questions on here, except for one more from Jamie. So this was Jenny, one of our English setter fosters, and she loved coming to work and sitting at the reception desk at Sundog Cat Moon, and this was the front door, so she'd just sit there, and then when people would come in, she'd just wag her tail and wag her whole body. It was really adorable. She's a sweetie pie. And then Jamie's asking if she wants to go grain-free, what adjustments do I need to make to the recipe, or what do I substitute? So grain-free is going to be a myriad of things to a myriad of people. And in most of the conventional diets, grain-free simply means substituting the carbohydrate source, which often can be things like rice, corn, things of that nature, for potatoes or beans or peas as a starch. And so, again, for most conventional foods, that carbohydrate quantity is going to be in the neighborhood of around 65 to 70% of the diet. And so what you would want to do is, for that 2 cups of rice, I would say you can substitute in, if you're going to go with the carbohydrate version, substitute in 2 cups of potatoes, cooked or sweet potatoes, or another bean. However, in my opinion, I think what I would do instead is add in more fat, or simply use in place of beans, because again, beans contain lectins, which are anti-nutrients, and this is considered to be what created the issue with dilative cardiomyopathy in dogs back when all of this was craziness. And granted, it wasn't for every dog, but it was a big problem in golden retrievers. So the other way to do this is to substitute in more fat. So, excuse me, for instance, 1 cup of cooked rice is about 240 calories. Conveniently, a tablespoon of olive oil, coconut oil, things of that nature is about 120 calories. So if you're going to remove carbohydrates, simply add for every cup you take out. So if we're going to take all of the rice out because you think that your pup is sensitive to it, then you would add 4 additional tablespoons of oil. And I'm sorry, the mowers have found us. So, but what I want you to think about, Jamie, is why do you want to go grain-free? And if it's because of a suspected food sensitivity, then what I would do is take out the things that you suspect to be a problem and see if things get better or not. And it will take about 2 to 3 weeks for the problem to improve. And then at the end of that 2 to 3 weeks, when you test the food, so for instance, let's say you're concerned about rice creating an issue. So what I would do to test it at the end of no rice after 3 weeks is add 1 to 2 teaspoons to tablespoons of rice per meal for 2 days, depending on the size of your pet, obviously. And what that's designed to do is the immune system is calming down, but it's still pretty sensitized to rice if it truly is reacting to it. And so you should see a fairly pronounced effect. And I wish I had a better way to tell you to do this, but it truly is the best way to know kind of what's going on, because it just, the food sensitivity tests, sometimes they work, sometimes they don't work. So I hope that is helpful. Let's see, and I think that's got all of our questions today. Is everybody doing okay? Things are relatively chilled out, I hope. So that's what I have for you today. Thank you so much for all of your purchases of Holistic Total Body Support and your subscription to Ipets Ally. That really has been wonderful, and it's been helping me make this business more sustainable. And so that's what I've got for you this week, unless you all have questions. Good. Let's see. So 2 years ago, Willie was on grain-free. When we got him better, he was on grain-free. He did react to turkey last week. So Jamie, what I would do is see if you can figure out what it was, which brand of food you were feeding, and see what the ingredients are there. And then emulate that with what you're doing with Crock-Pot. So if it was a bunch of, if it was turkey then, and now he's reacting to turkey, then what that tells me is his gut is really sensitized. And I think we've talked multiple times about rotation diets and things of that nature, and that's where I would figure out what he does not react to, and then using that template, which I will double check and make sure it is uploaded to the group files, but using the template, then build 3 different batches of food with 1 protein, 1 fat, 1 brassica, 1 other veggie. And then for carrots, you would rotate, unless that's a problem, and that has become a problem for a lot of folks. But I would try rotating carrots, butternut squash, and then acorn squash or something of that nature. And I would take the beans out because that's one of the more common things to create reactions. So unfortunately, you've got to kind of feel your way through it if what he was eating 2 years ago is creating problems now. So I hope that helps. All right. Any other questions you all can think of? If not, Hi-O and I are going to sign off, and we will see you next week. Keep the questions coming, whether through Facebook or email them to Hannah, and we'll get them answered for you. Many thanks, and take good care.